Here we are with Kim, and it is February 11th today. And right now we have her in a position where she can put her gastroc on a nice stretch. She is getting some pretty good dorsiflexion, still feeling quite a bit of tightness down through the musculotendinous junction of the gastrocnemius, and more tension on the lateral gastroc than the medial gastroc as far as her sensations go. Let's see if I can get closer here without messing it up too much. Yeah, I see my video up. So, when we go in and palpate right at that musculotendinous junction, we can definitely feel quite a bit of adhesions, and scar tissue, probably, consistent with just the healing process of the lengthening. The incision here on her lateral side is healing well, and the skin is starting to move nicely. The medial incision, you can tell a little bit more is involved. A little bit of a delayed healing. There's a little bit of a scab there, which makes me think there might be a little bit of delayed healing underneath it, and you can definitely feel some scar tissue and adhesions around that incision site as well. So been working on trying to release some of that. Yeah, go ahead and take a rest when you need to.
And then point out that spot to the left of the medial, to that, right in there, like all that horrible.
So this is where, we go up the Achilles tendon here, right into the musculotendinous junction, and just lateral to that is where she seems to get the most discomfort, and we can definitely feel kind of a lumpy type of adhesion. So just trying to work on lengthen that and massage that out a little bit as much as she can tolerate through here. And that seems to, kind of come down to this side, right, Kim? So it travels from the lateral side down to the medial side, and giving her some discomfort down into the tarsal tunnel there.
Between the ankle and up by the medial incision, it's softer there in the left. We've done a little bit better on the medial side.
Yeah. So on this medial side,
we've done a little better.
Yep. Up through this incision, down through the inside of the ankle. She used to have a lot of, posterior tibialis tendon seemed to be very irritated and tight, and that seemed to have stretched out a little bit, become more supple, and lengthen out. So the pain down through the medial ankle, down into the medial calcaneus is easing up a bit. Still dealing with some, inflammation there, though, using some ice and anti-inflammatories.
But the worst of the pulling is
right, that guy.
That and down all the way to the. And then in this extended position, then I can start to feel the insertion point of the lateral calcaneus, the insertion down at the back of the heel with the Achilles a little bit, in that.
Yeah, in the Achilles itself.
In that held position. Now, while you're doing that, I'll just go up on my toes just a little, and just so you can just see a little bit. Going up on my.
So we put her in a position to start doing some calf raises or some heel raises. So having her weight bear 50-50 on each leg. Squeeze a ball in between her thighs to keep her hips and pelvis engaged and lined up. Yeah, and she's traveling straight up. You can see the right heel, the right leg is stronger. It wants to lead a little bit. So just to focus on keeping the weight 50-50 and
there's no
coming
pain,
straight up. Yep.
So there's no pain from the incisions upward.
Mm-hmm.
I mean, the tightness is so bad,
Yeah.
below that.
Okay. So below the incision, she's getting lots of sensation of tightness when she does her calf raises. Any heel pain with this? activity?
No, I mean the heel comes. It just as I get up there, it goes from like here to here. The zone from here to here just turns into it's like it's a rock, and so the flow of feeling does not flow up to there. I mean, this is not hurting at all up here.
Yeah.
So does that make sense?
Yeah, I mean, I'm sure that's likely due to, the adhesions and the scar tissue that should resolve over time as we work that out.
And any comments on the talus? You mobilized it.
The talus on the left, is not gliding posteriorly real easily. And so we did some, work on that, some mobilizations and some stretching, and got it to glide better. Afterwards, she demonstrates an increase in dorsiflexion and is able to walk much more normally. So just keeping our eye on that, making sure that we can get that talus to glide all the way back, and that might be due to just the tightness in the, Achilles, and also due to that, distal fibular fixation.
Maybe why I'm just doing this, express that concern, like I was talking to you about the ability of describe that as I just
So, last summer, Kim had that distal fibular fixation, in which they, fixate the fibula against the against the tibia with a wire. And she was just concerned that she did not have full dorsiflexion at the time, and is worried that the fibula may not be able to splay enough to allow the talus to go all the way posterior when she goes into dorsiflexion.
So when I do this, it feels like as I come down, I come to a point, and then when it's like I get to a point, and then it's like I'm wishing it could give me a little bit more there.
Are you feeling some pressure in the anterior ankle there on the left?
I feel the tight, right behind where the lateral fixation is, of course, in the soft tissue. I just don't know the feeling. Yeah, I do, and I do start getting a lot of swelling in here when I've been on my foot in the day. I don't know if the glide is enough, if it's allowing on my own weight bearing to glide that.
Right. Far enough, yeah. That sensation.
Yeah, because this one feels like I could go farther, and I feel like I could go just maybe a little bit farther there, but then I either get blocked back here or I'm getting blocked in here too, and it could be just this. It's hard to tell.
Yeah. Well, normally we want you to feel a posterior blockage. We want you to feel a tightness
back here,
in the calf or the Achilles.
Right.
Yes.
Okay.
And that, that pinching or that tightness in the anterior ankle usually indicates that the talus is not gliding all the way, that it needs to be.
Well, yeah, it feels. I don't feel like an impingement. I just feel like it's just generally tighter through here than this one. That's the only way I can describe it.
Yeah.
Again, I don't know if the soft tissues are not letting it come and stretch or.
Yep. Yeah.
So it's just a concern.
Yep. So that's just in our plan to keep working on. Yep. To get that talus to glide better. And,
See,
but she is squatting much more deeply than she has been, than I've seen her, in months.
And that's just, I just want to also let him see what I got in my shoe. You can see my shoes.
So she's wearing a supportive hiking
so I have
type
that
shoe.
on.
She has a heel cup to cushion the calcaneus. She has
So I have that.
And a little, looks like about a 2 millimeter lift type insole, and then an arch support.
It's 2 or 3.
Okay.
And then I put that on that, and then I just want to tell him that Dr. Says I'm just too mobile, still mobile. My subtalar over here on my right. So Dr. the other day did put this on the orthotic, so I'm basically
using a heel cup and an orthotic with a little heightened arch support.
Yeah.
For the navicular there, it looks like.
And I've been telling him I've also been having to use an ace wrap on this ankle too, because it's struggles, and if it gets too much like that, then of course I aggravate this area in here, and I'm trying to keep that not aggravated.
So she's getting a little bit of too much of over pronation
Yeah, you can
through
see
that
it's
right
kinda-
foot. Yep, even with her hypercure fixation. And so we're hoping just a little extra arch support on that side will.
But the left one, the good news is what we can get some pronation now, right? We were like stuck like this,
Yep.
and now we're getting it, and
Yep.
so.
A good normal pronation. Yep. Yep.
But this one is you can see the difference. I
Okay.
mean,
Yeah, the right arch tends to.
definitely.
Definitely.
Yeah, it just goes. I mean, I have to really work at it, keeping it up.
Yeah.
And this one, before it used to be stuck like that, now it's like we're right where I think we should be. Now I really don't want this to get any looser. I just want to let this stuff get looser. Hopefully, loosening this up ain't gonna turn this into.
That's
but,
right.
You know, but we can
That's
always.
right. We want the midfoot to stay where it is. Yep. And we just want the hind foot to be able
Yeah.
to dorsiflex more. Yep.
All right. Well.
Yeah.